My history is that I was diagnosed at 6 months with a heart murmur. So I was followed throughout my life. I've had probably somewhere between 20 and 30 cardiologists that I've seen over the years. When I was 11, I started going downhill really rapidly, and the doctor I had said I wouldn't live to be 12. So I had my first heart surgery, and at that time valve replacements were not done, and so the bicuspid valve, which at that time was extremely stenotic, and I had insufficiency, they went in and they just, Dr. Hyman just clipped it open. I was told that that would probably last maybe 10 years, give or take, and it lasted me 43 years. During that time, I saw lots of doctors, and I can't even tell you how many times I've been put on Valium for anxiety medicine. All the Valium did is just make me even more tired and fatigued than I already was. In 2004, I started really going downhill again. I saw 3 doctors, and they checked my blood pressure, and it was anywhere from 140 to 150, and they were telling me, you know, this is kind of high, you should watch that. Well, what does that mean? None of them put me on any medicine, and they all concurred that I needed a valve replacement. And I could take my pick of what kind of valve I wanted. Pig valve, cow valve, mechanical valve. Somehow, when I was talking to them and seeing the different doctors, I kept having a feeling that something was wrong, something was missing. So I went on the web and I did a little bit of research and called around to some local doctors where I'm living now. I wasn't really happy. I didn't feel good about what I was hearing back. And coincidentally, at the same time, I'm the oldest of 7 children, and one of my younger brothers, John, was also seeing a cardiologist, but I didn't know that. And he had just gotten an echo done that week, and he was diagnosed with having a bicuspid valve, which one of my doctors had mentioned to me. I know it's in my records because, you know, that would have been indicated with the very first surgery. But I can't recall any doctors making it a point to tell me about it. So I had just, for some reason I remembered one of my doctors saying that, and I thought, well, isn't that strange that John has the same diagnosis? So what I found out immediately was that I needed to be put on blood pressure medicine, and I also found out that this is indeed a genetic condition that runs in families. Well, then I found out that not only can another family member have a bicuspid aortic valve, but brain aneurysms can also be a factor, as well as thoracic aneurysms. So coincidentally, at the same time, another one of my brothers, who was having a hard time hearing, went in to see a doctor, and because they couldn't find anything wrong with his ears, they did a head scan, and lo and behold, he has a brain aneurysm. The message is that the importance of family scanning. And even if members of your family don't have an obvious bicuspid aortic valve, it doesn't mean that they can't develop something down the line later. We found out that we have a family history of early deaths. We've had relatives that have died in their 40s, seemingly from a heart attack. I lost an aunt last year as a result of this condition. It's just important to have all members of the family scanned, and not only scanned once in their lifetime, but you know, followed up. So because it's a situation that can degenerate after years. My situation presented itself when I was a child, and but John, Mr. Athlete, Mr. Super Guy, he didn't start deteriorating until recently. We both had surgery from Dr. Racy in 2005, 2 months apart. We're a success story. Thank you.
I'm just going to give you a little bit of information on my side of the story, on my history, because I think that there's a couple things that are very compelling. I went to a local cardiologist and went to him and told him this is, well, first of all, when I was in high school, I was told I couldn't run anymore, couldn't participate in sports because I had a heart murmur. What does that mean? So I went to a different cardiologist, and they said that I had mitral valve prolapse and that I would outgrow it and they'd go ahead and run. So I kept running. And then when I was 45, a year and a half ahead of my operation, I went to one of the local cardiologists because I started telling him that I started getting symptoms. Chest pain, really tired, shortness of breath going upstairs, and that I was running slower than I was used to. And he goes, well, what does that mean? I go, well, things that used to take me 18 minutes to run are now taking me 25 minutes. He goes, well, come back when it's 30. And I thought that was kind of callous. And then he goes, well, let me put you on an EKG. And he put me on an EKG, and nothing showed for me. He goes, well, really, why are you here? You know, he made it seem like I had no reason to be there. And so I told him that I was diagnosed with a mitral valve prolapse because that's what I thought I had. And he listened, and he goes, well, let me listen. So he put a stethoscope on me, and he goes, no, he goes, I think you have a bicuspid valve. He goes, but people live with those, so it's no big deal. And he goes, if it gets worse, come back in a year, and we'll look at it then. And so that was about a month ahead of when Dianna got a hold of our list and Dr. Racy and all that. And I went down, and Dr. Racy saw me for 2.5 hours before I was even his patient, and answered all questions, and I thank God for you every day. And the rest is pretty easy. I went through a very easy operation. I felt it was easy. I don't remember any of it. Arliss was there. She got to watch me. And I had a very easy recovery. I'm back to running. The other last thing that Dianna did cover is that we did have some uncles who I remember when I was very young who died at a very young age. And they just said that they died from heart complications. It wasn't known back then whether or not it was from an aortic aneurysm or whether they were bicuspid or anything. In post-mortem, they didn't check it out. But my feeling is that it was probably related, and it is very familial. So, and we have it on both sides of our family, both maternal and paternal sides. So my aunt, who just died recently, is on my dad's side, and my uncles were on my mom's side.
What did your surgery consist of?
I had my bicuspid valve was replaced with a bovine valve, and my ascending aorta was replaced with Dacron.
We had the same thing.
Same operation. As far as I know, it's probably in the same room.